like to say a few words about digital impressions and where we've taken this technology from the background of digitalization that Mark alluded to a moment ago. Again, my name is Mike Reiners and I'm head of the iTero sales worldwide for Straumann. This video shows you briefly some aspects of the digitalization that Straumann has brought to the market over the last few years. We have three major components. We have a component that has been developed for the laboratory, a component that has been developed for oral surgeons, and then finally a component that has been developed for taking intraoral impressions, which I'll go into much more detail. The final component of Straumann's digital solutions, we have intraoral scan technology, developed by a company called equate, who are partners based in the United States. So the problem that is being solved by intraoral scanning or digital impressions is this. Traditionally, dentists take an impression of the patient's teeth with a flexible material that solidifies in the patient's mouth. This is typically an unpleasant situation for the patient, and actually, statistically, this is the number 2 reason why patients have fear to go to the dentist. Secondly, it's inconvenient for the dental professionals to execute on this process. This process basically requires preparation before the patient comes, after this solidifies in the patient's mouth, and then it is sent off to a dental laboratory. All of these manual steps could potentially be the source of an error. What we've taken from these elements, and we've created with our partners at Cadent a technology called iTero, which instead of taking a physical impression of the patient's teeth, now we're taking a digital impression using a highly sophisticated 3D camera that scans the teeth in rich detail and can be used exactly where the dentist needs it for analysis and also at the laboratory for the final production of crowns and bridges. And in Europe, Straumann is the exclusive distributor of the iTero technology.
To be scanned and the angle at which to scan.
A little bit of information about the technology and specific of how the process works. We have the first step, the dentist takes a scan of the patient's teeth, which you'll see Dr. Fahey do in a moment. During the scanning process, they can see specifically where the scanner is looking and the information that it's capturing. So they're doing a quality control check immediately during the scanning process. When the dentist completes the scan, they have a second opportunity to check their information, what they've scanned, make sure it's exactly what they need for a high-quality restoration, and then that's digitally transmitted to the dental laboratory. So instead of taking a physical impression and mailing it or sending it via courier to the dental laboratory, they send it electronically via email or an electronic process. That same information is then opened by the dental technician. They review the information, another quality control check that wasn't possible with traditional impressions, and then they can have a dialogue with the dentist as necessary to make sure that they have all the information needed for a high-quality restoration. They take that information and can either use it for a manual, traditional restoration, or they can send it to a high-precision production process for making the crown and bridge. Straumann offers this production process, as I mentioned before, through our CARES production facility in Germany. And finally, the dentist receives this component back, a crown or a bridge, let's say, and it's placed on the patient's teeth. Excellent outcome. 1, 2, 3, relatively simple process. Going into the technology behind this, the iTero system is essentially a 3D camera that captures the surface information of the teeth, the gums, and that information is displayed on the monitor next to the dentist's chair, and then is transmitted, as I mentioned, to the dental laboratory. It's very precise. And that's one of the key advantages, is that the way this process works, it captures the most minute details that are of interest to the dental technician and to the dentist. Secondly, it's very, very simple. So as we've all experienced with taking digital photography compared to normal photography from years past, everything is done right there. You have so much more information. It makes it easier for the dental practitioner to get it right every time. And lastly, it's efficient. So because you're taking a digital image and you're sending it electronically, you're able to review and call your case information back. It saves time at the practice. And on the laboratory side, because they're not dealing with physical objects, they save time there as well. So that's one of the key advantages of that technology. So if we look at the benefits of the technology, we of course have the patient first and foremost. As I mentioned before, many patients, roughly 20% on average, have a strong gag reflex or strong aversion to the taste of the impression material. So with this, there's none of that. The patient has a very nice experience. There's less time spent at the dentist because typically the dentist does not have to take a second or third impression to get it right. This is done electronically, properly the first time. And of course, a better end result. If the patient has had a good experience, the dentist has this rich information, and they've been able to check the quality at every step, it ends up in a better result. As you see in the image here, the dentist also has an opportunity to consult with a patient during the procedure and give them a level of comfort that they just might not have had with traditional processes. The benefits, of course, to the dentist, happier patients means better business, of course. So if the patient goes and talks to their friends and family about the experience they had because of iTero at their dentist, that's likely to lead to referrals and better business. And of course, with this technology, if you have access to the latest and highest quality manufacturing through iTero, it leads to better dentistry. Then lastly, the lab partners that work with the dentist to actually create the crowns and bridges, because they're getting consistently high quality information, they're able to do their job in a most efficient and high quality way. If we look at the utility of this device, it's essentially, as I mentioned before, a very high quality, high accuracy 3D scanning system. So it can be used in a number of different areas. For Straumann, we have implant solutions, as Mark Hill mentioned earlier today. The digital scan information from iTero can be used for placing the implant restoration in a very accurate way on the Straumann implant, or on traditional crowns and bridges where the dentist has prepared the natural tooth to accept a crown. The system provides information for that as well. And in a very new innovation, our partners at Align Technologies have created a connection with the Invisalign process for orthodontics, which uses a series of clear aligners to help move the patient's teeth into the appropriate position after a series of treatments. A little bit about the adoption of the technology. It's relatively new technology. We're really at the forefront of introducing the technology not only here in the UK but across the world. But it's important to see that this is also an understood technology, and it's being widely used worldwide currently. More than 500,000 crowns and bridges have been produced by this technology up to date. Nearly 2,000 dentists are working with it day in and day out around the world. And more than 1,000 professional laboratories are engaged with this technology. So this is not something that is just a dream or an idea. This is here and now. It's being used on a daily basis by professionals around the world. But a final thought about this is, where are we going with this? It's not if the technology is going to be adopted and replace traditional impressions. It's a matter of when is this going to occur. Because as we've seen, and as I alluded to before, digital photography has completely replaced, for the average person, film photography. And the same trend is happening here. Digital impression taking will eventually replace traditional impressions completely, in our view.